sexually transmitted infections are the human papillomavirus. My name is Dr. Nainen, and I'm a family doctor, and here I'm going to go through what you need to know. HPV is an infection you probably didn't know you have. Around 8 in 10 people get it at some point in their life. So I will go through all the facts you need to know. HPV stands for the human papillomavirus. It's the name of a group of more than 200 viruses that infect humans. Most people with HPV won't even know they've been infected. It's the most common sexually transmitted infections in the United States, and there are more than 40 HPV types that can infect the genital areas of both men and women. HPV can predispose you to some types of cancers, and in women that usually includes cervical, vaginal and vulval, and for men that's usually penile cancer. It can also affect the anus and the oropharynx. Understanding HPV testing and diagnosis. People often ask, where does HPV come from? Well, here are the facts. Most people catch HPV by having vaginal, anal or oral sex with someone who has the virus. It can also be spread through genitals or genital touching with someone who has the virus. Sharing sex toys is another way of becoming infected. How is HPV transmitted? You can be infected with HPV and have no symptoms, so you won't know you're passing it on to someone else. Symptoms can develop years after you're infected, so it'll be difficult to work out where the virus came from. There's currently still a low uptake of the HPV vaccine in eligible people. There are ways of getting tested for HPV, and this is usually during screening programs, such as cervical screening. Cervical screening checks the health of the cells in the entries to your womb, called the cervix. How cervical screening fights HPV and cancer. HPV testing can pick up on high-risk HPV strains. If a high-risk HPV infection shows up, then more cells from the sample can be tested to check for cell changes that are either precancerous or cancerous. The good news is that these cell changes can be detected early and then treated before any cancer develops or spreads. How often to get your HPV and Pap test? A HPV test is usually a swab and looks for types of high-risk HPV that can cause cell changes. A Pap test or cervical smear looks for precancerous cell changes on your cervix, which may in time become cervical cancer. In the US, how often you get tested depends on your age, your medical history, and the results of your previous tests. But generally speaking, if you're between the ages of 21 and 65, it's around every 3 to 5 years. In the UK, HPV testing is recommended as part of our national screening program, and that includes women between the ages of 25 and 64. Usually it's around 3 years, and at later ages it becomes every 5 years. Will HPV go away? In most cases, yes. Usually within around 2 years in 9 out of 10 cases according to the CDC. But it's still possible to pass on the virus to someone else during this time. And some types of HPV can stay in your body for longer, and it also depends on your health. It's important for women to know that HPV can put them at risk in ways they might not realize. But with safe sex, the HPV vaccine and regular screening, you can do something about it. Best remedy and cure for the HPV virus. So what happens if you have HPV or cell changes on your cervical screening? Well, if HPV is found or you have a HPV positive result, but no precancerous or cancerous cells, your doctor will advise you what to do next. But usually this involves additional screening and regular appointments. If precancerous or cancerous cells are found, your doctor will advise you what to do next. In some cases, you will need to have these cells removed, and in other cases, you may have more frequent monitoring. Treatment options for precancerous cell changes. If abnormal cells are picked up on your Pap smear, treatment options include colposcopy. This is a procedure to take a closer look at your cervix and check for abnormal cells. Cryotherapy. This is a treatment to freeze and remove precancerous cells. Loop electrosurgical excision procedure, and that's a treatment that uses an electrical current to remove precancerous cells. This can be a worrying time, so make sure you talk to your doctor and get the support you need. How to prevent yourself getting HPV. The best ways to protect yourself from the HPV virus is safe sex. This involves using condoms or dental downs or any other barrier method of contraception every time you have vaginal, oral or anal sex, as this reduces your chances of getting HPV. But remember, it can be spread through skin-to-skin contact. Number 2, don't skip cervical screening. If you've been infected with high-risk HPV, HPV testing will be able to tell you, and also the cervix can be checked for abnormal cells. Number 3, getting vaccinated if you're eligible. The HPV vaccine protects you against HPV, but it doesn't treat existing infections. This is why it's recommended at younger ages before you become sexually active. What are the symptoms of HPV in females? Most people will clear HPV from their body within around 1 to 2 years. But if it doesn't go away, some types of HPV can go on to cause symptoms or health conditions, such as, some types of cancer. There are 2 main types of HPV that cause genital warts, which are painless lumps or growths around your vagina, anus, or penis. The types of HPV that causes warts are different from the type that cause cancer. So if you get HPV warts, it doesn't mean you'll go on to get cancer. What are the symptoms of HPV infection in men? Most men who get HPV will never have symptoms. The infection usually goes away on its own. But if HPV doesn't go away, it can cause symptoms such as genital warts or lead to certain types of cancer. Make sure you talk to your doctor if you have any unusual lesions on your penis, scrotum, anus, mouth, or throat. This can include if you notice warts, unusual growths, lumps, or even sores. It's always best to get medical advice. What and which types of HPV cause cancer? There are about 14 high-risk HPV types, including HPV-16 and HPV-18, which are responsible for the majority of HPV-related cancers. Cancer usually takes years or even decades to develop after a person gets HPV. There's no way to know who will develop cancer or other health-related problems from HPV. People with a weakened immune system, however, are more likely to develop complications and are less likely to be able to fight off the HPV infection. HPV vaccination protects you against 90% of cancers caused by HPV. That's why HPV vaccines work best given at younger ages before you become in contact with the HPV virus. More than 9 out of 10 cases of cervical cancer are caused by HPV. Almost all cervical cancer can be prevented with HPV vaccination. In summary, HPV is a common sexually transmitted virus that can have serious health consequences. Most people with HPV do not have symptoms, so getting vaccinated is the best way to protect yourself. Unfortunately, currently there's no cure for HPV. However, there are treatments available for the complications caused by the HPV virus. Practicing safe sex by using condoms or barrier methods of contraception can help reduce your chances of getting HPV. Remember, early detection is key, so speak to your doctor if you have symptoms, concerns, and remember to attend your screening programs. I hope you found today's video informative, and thank you for watching.